Helicobacter pylori infection. Definition: Helicobacter pylori, previously known as Campylobacter pylori, is a gram-negative microaerophilic bacterium usually found in the stomach. It was identified in the 1982 by Australian doctors Barry Marshall and Robin Warren, who found that it was present in a person with chronic gastritis and gastric ulcers. It is also linked to the development of duodenal ulcers and stomach cancer. However, over the 80% of individuals infected with the bacterium are asymptomatic, and it may play an important role in the natural stomach ecology. Applications in medicine. Up to the 90% of people infected with H. pylori never experience symptoms or complications. Acute infection may appear as an acute gastritis with abdominal pain, stomach ache, or nausea. Where this develops into chronic gastritis, the symptoms, if present, are often those of non-ulcer dyspepsia, stomach pains, nausea, bloating, belching, and sometimes vomiting or black stool. Diagnosis: HP testing is only recommended if a clinician is prepared to treat a patient with positive test results. Endoscopy tests are serology, qualitative or quantitative, immunoglobulin G, urea breath test, stool antigen test, and the non-endoscopic tests are histology, rapid urease test, culture, and PCR assay. Treatment is recommended. Regimens usually contain 2 antibiotics and 1 inhibitor to proton pumps. The duration are between 10 and 14 days. General compliance is the issue. Patients should explain to accept minor side effects and regional antibiotics resistant. Pros and cons. Pros are prevention, diagnostic tests, and treatment with appropriate antibiotics are enough to the complete eradication of Helicobacter pylori. Cons. Individuals infected with H. pylori have a 10 to 8% lifetime risk of developing peptic ulcers and 1 to 2 risk of acquiring stomach cancer. Issue apply in Ecuador, and 75% of patients in Ecuador over 20 years old live with Helicobacter pylori without any illness or discomfort. Only 2 or 5% will have serious gastric problems. Conclusion: H. pylori continues to be one of the most common bacterial infections in humans. Prevention is the key point of success for the complete eradication of H. pylori in our environment. In Ecuador, we must organize campaigns that communicate risk factors to the community to implement appropriate prevention. Thank you.